Okay, today we're going to dive into one of the most common and most critical challenges that any clinician faces. How do you manage a patient's anxiety and build trust when the pressure is really on?
You know the scene. We've all been there. You have a patient who is so overwhelmed with fear that it's like a wall just goes up, they can't hear you, they might be fidgeting, asking the same question again and again, or maybe they just completely freeze. And look, it's more than just an awkward moment, it's a huge barrier to actually giving them the care they need.
And that right there is the key. When a patient gets anxious, their ability to pay attention just tanks. They can't process information, and any trust you've built can start to crumble. So, managing that anxiety, it isn't just about having a good bedside manner, it's absolutely essential for clear communication, for shared decision-making, and, for better health outcomes all around.
So, where do we even begin? Well, the first step is you've got to learn to read the signs, because patient anxiety doesn't always wave a giant red flag.
It's really important to understand that not all anxiety is created equal. On one hand, you've got what's called situational anxiety. This is totally normal, right? It's that short-term fear that pops up because of a specific event, like hearing some tough news or getting ready for a procedure. But then, on the other hand, there's clinical anxiety, which is a much more persistent, diagnosed condition. Knowing which one you're dealing with can totally change your approach.
So, what are we actually looking for? How does this anxiety show up? Well, you might see it physically, the rapid breathing, the shaking hands, or it could be behavioral. Are they avoiding eye contact, or are they stuck in a loop, asking the same question over and over? Do they seem totally frozen, unable to make a decision? These are the signals we just can't afford to ignore.
And this slide explains exactly why that happens. When the brain is just flooded with anxiety, it literally flips a switch into survival mode, that classic fight or flight response. All the logical, careful thinking parts of the brain take a backseat. And that means it is genuinely physiologically harder for a patient to take in what you're saying, to follow instructions, or to feel like they can trust you.
Okay, so we've gotten pretty good at spotting the anxiety. Now, the big question, what do we do about it? This next part gives us two powerful blueprints, proven models that give us a roadmap for these incredibly tough conversations. First up is a model called Spikes. Now, this was originally designed for delivering really serious news in oncology, but honestly, its principles are a game changer for any high-stress interaction you can think of. It's all about having a clear, empathetic structure. So let's just walk through it. It starts with S for setting. You got to create a private, safe space. Then P for perception. You ask them, what do you already understand about what's going on? Next is I, invitation. You ask how much detail they actually want to hear. Then comes K, knowledge, where you explain things clearly and simply. The next step, E, is crucial, empathy. You have to stop and acknowledge their emotions. And finally, S, strategy and summary, where you lay out the plan so they leave knowing what's next. It's such a powerful, structured way to keep things on track.
Now, our second blueprint is Robert's 7-stage crisis intervention model. If Spikes is our roadmap for tough conversations, think of this one as our emergency toolkit. It's especially useful for those moments of just acute, overwhelming anxiety, where your first job is to de-escalate the situation and bring things back from the brink. Let's walk through these stages. It all starts with safety. First and foremost, is anyone at risk? Once that's clear, you move to rapport, building that human connection. From there, you identify the problem, really zeroing in on what triggered the crisis. Then you deal with the feelings directly. Only after that can you start to explore coping options and create a real plan for action. And this last step is so important. Follow up. It shows the patient they're not alone after the crisis is over. It's a fantastic sequence for guiding someone from chaos back to a state of calm.
All right, we have our frameworks. Now let's get even more practical. We're going to look at 7 specific evidence-based techniques that you can literally start using in your very next conversation.
Think of this as your practical toolkit. Each one of these techniques is designed to tackle a different part of anxiety, whether it's validating their feelings or just giving them back a little bit of control. I mean, look how simple this is, but it is so incredibly powerful. Just saying something like that, validating that their feelings are normal and okay, it can instantly lower their defenses. It says, I hear you and I get it. And that is the absolute foundation of building rapport.
So much of anxiety comes from feeling powerless, like you're strapped into a roller coaster you can't control. A great way to counteract that is to give some of that control back. Whenever you can, involve them in the decisions, even small ones. Offering choices shows them they're an active partner in their care, not just someone things are happening to.
Okay, this one is fantastic. When you see a patient start to spiral into panic, you need something to pull them back to the present moment. This grounding technique does just that. You calmly ask them to name 5 things they can see, 4 things they can touch, and so on. By getting them to focus on their senses, you're yanking their brain out of that internal loop of fear and back into the real world. It's a great tool. And here are 3 more that are just fundamental. First, active listening. It's not just hearing words, it's showing you're present with your whole body with steady eye contact. Second, chunking information. Don't dump a mountain of data on them. Break it down into small, digestible pieces so they don't get overwhelmed. And third, create a safe environment. A quiet room can make a world of difference. Each one of these is another brick in building a foundation of trust.
All right, for our last section, let's flip the script. We've talked a lot about what to do. Now let's cover what not to do, because sometimes, even with the best intentions, we can accidentally make things worse. This is so important. First, avoid false reassurance. We say everything will be fine because we want to help, but what if it isn't? When you promise something you can't guarantee, trust just evaporates. Same goes for don't worry. It can sound like you're dismissing their feelings. And of course, rushing the conversation or using a bunch of medical jargon just builds that wall even higher. Avoiding these traps is just as crucial as using the right techniques.
And that really is what this all boils down to. Calming an anxious patient isn't about having some magic words. It's about your presence. It's about your empathy. The calm that you bring into the room is contagious. It creates a space where a patient can feel safe enough to actually listen, to understand, and to work with you. And that connection, right there, is what turns fear into trust.